Hi guys, welcome back to my channel. My name's Molly. I do mental health, lifestyle and taboo topics here on my channel, and today I'm going to be talking about bacterial vaginosis, otherwise known as BV. I have done a similar video like this on my channel on thrush, which I'll leave up above, but it was in the beginning stages of my video making and it is a bit long-winded, so you don't have to watch it. I will mention or touch on thrush a little bit in this episode. I do go into much more detail in the video that I'll leave linked above and in the description. What I learned when I done that video was that a lot of people want to know about these type of topics but are too scared to ask people. I got so many messages about how to treat thrush, what is thrush, how is thrush caught, can you pass thrush on, and all of the people said the same thing, that they didn't feel comfortable asking other people. I think I'm going to make this into a little bit of a series. I'm going to talk about taboo topics people don't want to talk about but need to know about, and it is important. And I'm going to start it off by talking about bacterial vaginosis. What I'm going to talk about in this video is what is BV, how to diagnose BV, how to treat BV, and then prevent BV. Bacterial vaginosis is a very common bacterial infection that anybody that has a vaginal area can get. You don't have to have had to get bacterial vaginosis, and it's not an STI. However, they do say that increased sexual partners and changing in partners can cause BV to happen, but it is not an STI and it does not mean that you are dirty. It's just an imbalance of good and bad bacteria in the vaginal area that causes BV. So some of the main causes of bacterial vaginosis, as I've said, are a change in partner, multiple sexual partners, using perfumed or heavily perfumed products in that area. It can also be somebody who gets baths very regularly and they use a lot of bath bombs. Also, if you've had a IUD put in or taken out, I know that I definitely had more frequent BV infections when I first got my coil put in, and that lasted for about a year on and off. I did have quite a few episodes of BV. BV is similar to thrush, but it's not as widely known. Obviously, again, when you get thrush, that can be caused by an imbalance, but thrush has more physical symptoms than BV. So thrush tends to cause itchiness, soreness, dryness, cottage like cheese discharge, and a smell, whereas the main symptom of BV is just a very strong odour. And I can definitely say that being someone who's had it multiple times, you tend to know the difference in the smell. BV is very strong and it is kind of like a fishy smell. Obviously the vagina should smell, it should have its own smell. It's not going to smell like roses and you shouldn't expect it to, but this would be a very noticeable change in the smell, and it can get worse after you've been intimate with a partner or when you go to the toilet. However, when I did have BV, when I was on holiday, even without those two things happening, I could smell it. I knew that I had it. It was very, very strong. If you are worried that you have BV or you're concerned that you might have BV, then there are two things that you can do. Number one, obviously, is go to your doctors or a sexual health clinic to get tested. They will do a quick test, and it's normally, they use something, I don't know if it is litmus paper or it looks like litmus paper. They'll do a test to find out if you have BV or not, and they'll also test for other things like STIs and thrush. Or you can now get an over-the-counter or online tester kit. I'm going to leave an example here of one from Canesten. What that does is you would buy the kit, you would do a swab, test it, and then it will show you markers on the instructions of what it is showing that you have or potentially have. So it will show you whether you need treatment for thrush or you need treatment for BV, is normally the two that it will test for. Now, I would obviously, from a medical standpoint, recommend speaking to your doctor or doing a test before treatment. However, I have done treatment for BV before without buying the test or going to the doctors because I just knew the signs, and I would have then attended the doctors if I hadn't got better after the treatment that I used. There's two types of treatment for BV that you can get from over the counter. I'm going to leave examples on the screen and I will link all the products down below as well. But the first type of treatment is a pessary. Now with BV, unlike Thrush, which is normally a once and done treatment, the BV treatment normally spans across a 7-day period. And you can get pessary or like a squeezy tube. I will show them on the screen. I have a pessary here that is for something else, but it will look like this. It will come in a package very similar to this. You would peel it open like this, and it would probably be this. This is a glycerin pessary, so it may be different consistency, but it looks like a bullet. And what you would do is, sometimes people like to make the tip wet with some water. It'll tell you the instructions in the pack, but I know that sometimes people just want confirmation of what they're supposed to do. I would, and what they recommend, is to wait until at night when you've been to the toilet, you've got into bed, and then you would just insert this up into the vagina and you would leave it there overnight. And then when you go to the toilet, there may be a little bit of cream or a little bit of discharge, but that's completely normal. And you would just wash and shower as you normally would, and then you would repeat that for 7 days consecutively. So that is the first type of treatment that you can get for BV. The second type of treatment I haven't got an example of, but I will show a picture on the screen, and it's very similar. It will come in a tube that has the liquid in the bottom and a stalk. You would just insert that once you've opened it into the vagina, squeeze it out, and then pull out the plastic squeezy tube, throw it in the bin. And again, I would do that at night before you go to bed, leave it overnight, and you would again do that for 7 days. The only difference really is how the treatment is inserted. The insertion with the tube, it'll be liquid as soon as it goes in, whereas with the tube it'll be solid, and then it will warm up over the course of the evening. If you are worried that you may have thrush, again, the video that I did previously explains how to insert and use the treatment depending on what type of treatment that you've received for your thrush. Now, that is the treatment types that you can buy over the counter. If you don't want to buy a treatment over the counter, you can obviously go to your doctors. They may provide you with antibiotics. Now, if you use the 7-day treatment and you are still having symptoms, or it hasn't gone away, or it's gotten worse, I would definitely recommend speaking to your doctors, because it could be something else. You could be having these problems because of a completely different reason, or you may have had BV but you've also got something else going on. I always recommend speaking to a doctor, and if the treatment hasn't been able to help and it is BV, it may be that you just need some antibiotics. It's nothing to be ashamed of. It doesn't mean that you are dirty in any way. It's not an STI, and you also shouldn't be ashamed of going to the doctors for a health reason, any health reason. They've seen it all. They don't care. They really couldn't care less. So that is how you would treat BV. And lastly, how to prevent BV or avoid or try to avoid BV. There's a couple of things that you can do to try to prevent getting BV. Now, douching, I think that's how you pronounce it, is not really something that we do over here in the UK, as far as I'm aware. I know it's more of an American thing, but douching is where you use a squeezy device to flush water up into the vagina to clean it. It's not needed, it's not recommended by any medical professional, and it can in fact upset the balance in your vagina. Your vagina cleans itself. It is a self-cleaning system. And another thing that people do that you really shouldn't is using scented soaps or even soap on the area. If you are washing everywhere else correctly and you're getting the recommended showers or baths, you don't need to be using soap on there. Water is sufficient. I was told this when I was a teenager, and I thought that is disgusting. that people are doing that, and I for years didn't, and I used to suffer really badly with water infections, with thrush and with bacterial vaginosis. I remember getting a really bad bout of thrush when I was 13 and didn't know what was happening, and I was terrified because I didn't understand what was wrong. But some people will be more sensitive than others to fragrances and soaps, but all you're doing when you're using those soaps is upsetting the pH balance. Once that gets upset, then that can then cause things like thrush, like bacterial vaginosis. So it's recommended just use water, or if you really feel like you need to or want to, a sensitive non-fragranced soap would be better than using the standard fragranced soaps. Another thing, if you are someone that's getting a infection quite frequently and you get baths, avoid using bath bombs again, or anything that's really scented, because you are just sitting in the bath, and obviously that is going to eventually get to the area that it could potentially upset. So try to avoid using them for a while, and maybe even avoid baths for a couple of weeks while everything just settles down. Another thing is condoms can really help with preventing BV. It's not a sexually transmitted disease, as I said before. However, the changing of partners can cause the upset, because different partners will have a different pH. I'm not entirely sure how it works, but everybody's different, and nobody's pH levels are the same, or nobody's sperm is the same, so that change can upset your balance. Again, I'm not a doctor, but that's how I understand it. So using protection when you are being intimate can help prevent an infection such as BV or thrush. So that is everything I think that I wanted to discuss on BV. If you've got any questions, please leave them down in the comments below, because there might be somebody else out there that's got the exact same question, or there might be someone that has the answer, and the more information that we can get out there, the better for people. I know it can be horrible when you feel embarrassed or ashamed about something, especially when it's something that's so taboo and we are taught for a young age to be ashamed of it. Please, if you've got any questions, don't be scared, leave them in the comments. Reach out to me on my Instagram. I know a couple of people did that from my last video. I'll leave my handles on the screen now. Please subscribe if you wouldn't mind. I would really love for you to join the little family that we're building. And if you've got any suggestions for taboo topics, please let me know. But for now, that is everything. So wherever that you are, I hope you have a lovely morning, day or night, and I'll see you again next time. Bye.